Hi everyone, Dr. Jesse Houghton here again. I have an interesting topic for you today. Many of you have heard that the voters in Ohio have voted to approve the legalization of recreational marijuana. With the passage of this law, it is expected that cannabis use will certainly increase. To what extent, we shall see. So in light of this new law, I thought it beneficial to discuss an interesting syndrome that can be caused by smoking too much marijuana. This syndrome is called Cannabis Hyperemesis syndrome, or CHS. Cannabis, referring to the use of marijuana, hyperemesis meaning severe vomiting, and syndrome, well, we've all heard that word before. The symptoms that occur with this syndrome include episodic severe nausea and vomiting. Now, typically, these episodes occur for a few days consecutively, then resolve completely for anywhere from weeks to months, and then the flares occur again. Now, this does not occur with the occasional marijuana user who smokes marijuana every so often. To get this syndrome, one has to smoke nearly every day, or at least multiple times a week. How long does someone need to smoke marijuana in order to get this syndrome? Well, it varies, but some reports suggest that the average time of use before this syndrome occurs is 4 years. However, it can occur more quickly than that. Two really interesting points about this condition that I wanted to mention. One, most people think that smoking marijuana will actually help nausea and vomiting and also increase appetite. And when used in moderation, this is often true. This syndrome is a classic example of too much of a good thing may actually be bad. And number two, what makes people with cannabis hyperemesis syndrome feel better? Hot baths and hot showers. In fact, patients will often spend hours in a hot bath or a hot shower to relieve their symptoms. How do we treat CHS? Well, we can try to counteract the symptoms with nausea medications such as Zofran, Reglan, Phenergan, Compazine, or we can get at the heart of the problem and have the patient stop using marijuana or at least significantly cut back. Well, that's all for now. Be well, everyone.